Representative Ben Fuhriman, how are you, sir?
I'm great, Matt. Thanks for having me today.
Of course, man. Listen, you and I got connected because a lot has been going on around Medicaid, the Medicaid reform bill. And Representative Rubel came in recently and she said, look, this is a repeal bill. This is not a reform bill. And she went into a couple details on it and like, oh, that seems great. Like, yeah, understanding, because the reform bill essentially requires that several things have to happen in order to keep the Medicaid expansion. Now, the problem is, as she was saying, she was like, you're never going to be able to do these things. Some of them involved requiring the federal government to comply with different things Idaho's demanding. Some of them involved federal courts in other states to reverse their decisions on things. I mean, not that Idaho has any ability to persuade federal courts in other states. So there are a lot of problems with it, but you actually emailed me and said, hey, there are these other things as well. So I'm very uneducated on Medicaid expansion, and I'm even more uneducated on this reform bill. So you came in to help me understand. Hit me with it.
Yeah, thanks, Matt. I think what people need to understand is the drafting and the design of this bill, not the intention. The intention, I think most people agree with. We need to try to put some guardrails, make Medicaid more efficient, more effective, save taxpayers' dollars,
Sure.
Make sure people who are using it deserve it. I think everybody's okay with that.
Sure.
But the way this bill is designed will repeal Medicaid expansion. And I just can't stand by and not explain that to people and the reasons why.
And again, let's just be clear on whether it will or will not. And you can tell me all the reasons. And then if people want it repealed or not, like, fine. But let's just be clear on what this bill is. If you're listening to this podcast on Apple Podcasts, Spotify, or any other audio-only platform, please jump down and give it a quick follow and a review. The Ranch Podcast is the only podcast in the state of Idaho that has access to this many Idaho leaders, and your support is greatly appreciated.
Correct. And those who are in favor of this bill want to ignore the repeal part. They want to say, well, that's just leverage. We're just trying to get the federal government to act. Okay. It'll repeal Medicaid expansion. My experience in my life is as a financial planner and in the insurance industry. I work with health insurance. I work with clients on a daily basis. We do retirement planning. We do financial counseling. I have clients who are on Medicaid expansion, who are just trying to get their life figured out, who are in between jobs. I see it every day. I have called health and welfare with clients to help them get enrolled in Medicaid expansion. I've been through the process more times than anybody in that state house has. And I understand some of these waivers that are being requested, 2 of them specifically. And people should know that there are 11 waivers in this bill that are being requested. If those waivers are not approved by the federal government and implemented by the departments by July of next year, 2026, then the Department of Health and Welfare is required to begin removing people from the Medicaid expansion rolls in 90 days. Okay, there's so many problems with this. First off, you remove them in 90 days, you can't, okay? Because they have the right to a hearing if their Medicaid expansion is taken from them, and that can delay things for months. So you can't just snap your fingers and remove them. Also, if you take away Medicaid expansion once we've already entered into the agreement with the federal government to do it, the federal government has to agree to allow Idaho to stop doing Medicaid expansion. So that's a whole process in itself. It says, hey, federal government, we don't want to do this anymore. Here's the divorce papers, let us go. And we don't know if that will take 72 hours, or it could take 72 months. We don't know. So the idea to force the health and welfare to just start removing people is going to create lawsuits like you can't believe.
And to be clear, what you're saying, at least with the hearing portion, it's like, listen, if we took away Medicaid expansion from somebody right now, they're entitled to a hearing, and essentially like somebody, they're like, hey, I want a hearing. I want to understand why.
Correct.
And right now, we have roughly between 80 and 90,000 people on Medicaid.
We're using the number 90,000.
Okay, great.
Right? And yes, so 90,000 people could potentially file an appeal with the Department of Health and Welfare, and they would have to answer each one of those.
Oh my God.
Because, that's not going to take full-time employees at the Department of Health and Welfare to figure that out.
Okay, so that's a problem. The second problem is that even if we say we want to break up with the Medicaid expansion, the federal government doesn't have to let us instantaneously. Like, they don't have to say, okay, great, effective immediately. We don't
even know. It's never been done. In 55 years of Medicaid, it's never been done. And we had the good speaker was on your show. I listened to him and he said it could take 18 months for them to approve it and they might not approve it. I got digging into that because that made me wonder, is he right? And I can't even find anything that talks about the process, but I do know that it's not a one-sided divorce. Both sides have to agree to allow the state of Idaho to stop doing Medicaid expansion.
Okay, now what we've just talked about is if this comes to pass and if the conditions of the reform are not met, then we're in a whole problem. So what are the conditions of the reform that make this so impossible?
So I just want to touch on two of these waivers. And again, there's 11 of them. One of them is the work requirements. Okay, now this bill says that if you're not working at least 20 hours a week or doing volunteer work or in school, then you do not qualify for Medicaid expansion. The mission of Medicaid per CMS is to enroll and give coverage for people who don't have it. The mission is not to keep people off who shouldn't have it. Does that make sense? So everything that CMS does and has to approve by law has to help that mission. So there's only one state that I've been able to find who has a work requirement that's in place, and that's Georgia. Georgia does not have Medicaid expansion. They don't have it. So if you're in that gap, you're an able-bodied adult in between jobs, you don't make enough money at your current job, whatever it is, and you would normally qualify for Medicaid, Georgia says, sorry, too bad. Georgia is where Idaho was prior to expansion being approved, okay? So Georgia came in and said, look, we feel like it's good for people to have health coverage. That's probably a good idea. We just don't want to cover everybody. And so if people will meet certain requirements and show that they're working, but they simply don't have the skill set or they don't have the job or they're volunteering, they're doing these things, then we will pay for their health coverage through Medicaid. And the federal government said, after the courts forced them, said, okay, but that increases the number of people on Medicaid, not decreases. It does the complete opposite of what this bill's waiver wants to do.
What do you mean it does? So how would adding the work requirement increase the number of people?
All right, let's say that I am currently working. I live in Georgia, okay? And I am making $9 an hour because I'm going to school at night and whatever, all right?
Remedial job.
Correct.
Right.
And I don't have enough income to be able to afford health insurance, and I would normally qualify for Medicaid, okay? But in Georgia, I can't because they don't have Medicaid expansion. Okay. So if I go to Georgia and say, hey, I'm working, I'm trying, I'm doing what I can, Georgia will say, okay, yeah, you are. Let's enroll you in Medicaid. Now a person is enrolled in Medicaid that wouldn't otherwise have been. But in Idaho, what this bill says is if you are on Medicaid, because we have expansion, so we have to cover you, and you're not working, then we are going to disenroll you. Does that make sense? It's the opposite. Georgia can't disenroll you from Medicaid for not working because you're already not covered because they don't have expansion. So CMS said, okay, we can go for this because you're going to include people in Medicaid who currently are not. Now, what is not being said is it costs the state of Georgia $26 million a year to maintain and manage that program. So how much is it going to cost Idaho to maintain and manage a work requirement program? We don't know because it wasn't told to us.
So you're saying, look, there's a mechanism to enroll people because of a presence of work, but there's no precedence right now to unenroll people because of a lack of work.
That's
right?
correct.
That we have a one-way path right now, and what Idaho's proposing is the opposite, which is in the absence of this thing, we're going to take this thing away from you.
Correct. And that goes against CMS's mission for Medicaid. And so they have denied that waiver in every single state it's been attempted.
In Georgia, and you may not know this obviously, but in Georgia, say I have a job and I'm trying and they enroll me in Medicaid. I lose that job. I'm now unemployed. What happens?
Like if I show them that I'm still, the work requirements are not just a job, but I'm volunteering, I'm going to school, I'm doing other things to try to better my situation, I could stay on Medicaid in Georgia.
Okay, but if we ditch all of that, then Georgia presumably has the same reverse principle, which is like, hey, you ditch. Okay, so it's effectively it works both ways in Georgia. It's not just one. It's not like once you're on, you're on forever.
But they're at different starting points, right? Georgia doesn't have Medicaid expansion.
Yeah, I got you. So the whole idea is like, let's get more Georgia people on that are doing this thing. And then if they fail to do it, we'll get rid of it. Whereas Idaho already has everything. And they're like, let's contract this.
And that is why the courts came into Georgia and said, yeah, CMS has to approve that because it goes to CMS's mission. It goes to the federal government's mission for Medicaid, and it's going to increase coverage, not decrease.
Don't judge me too much. What is CMS?
Center for Medicaid,
Okay.
Center for Medicare and Medicaid Services.
Okay, thank
Yeah,
you.
that's
We're on the same page.
Yeah, it's the department within HHS that oversees all of these things.
Understood.
And
Understood.
what frustrates me too is that, yes, President Trump is president. Yes, he's moving at unprecedented speeds. Yes, he's stroking his pen everywhere and making things just happen. But he doesn't control everything. There are laws in place. There are missions in place. There are courts in place. There are checks and balances. So we might get some of these expansion or some of these waivers approved, and then 2 months later they'll be turned down by the courts, which is what has happened in a lot of other states.
Or we could get some that, President Trump would approve, and then the others that have to do with the courts that President Trump can't control. They would not be approved.
Right.
And
then the whole thing gets repealed. Because if even one of these waivers is not approved and implemented by the deadline, it's repealed. And that, jumping ahead, that comes to the next waiver, which is
Could I ask
1332.
one more thing about this? You said something that I think is really important. You're like, listen, the role of Medicaid expansion was to grab people and help them have health care that don't have health care. Right. That was the whole point of Medicaid expansion. The point of Medicaid expansion was not give people healthcare conditional to these things, right? Because there's a benefit to providing healthcare to people, whether or not they have a job. Like you could get in an astronomical or like horrible car accident. It's important to have medical insurance for that. It's important to protect the people of Idaho who are going to foot the bill for the person who's uninsured.
Correct.
Because the Medicaid expansion as it stands right now makes or saves Idaho more money in things of the nature of savings for catastrophic events for uninsured, because if you're in a catastrophic car accident, you're going to get medical care at the hospital, whether or not you can pay them a single dime. And ultimately, it's the state of Idaho in some form or another that picks up that tab.
Right.
We have that. We also have because we get roughly $1 billion from Medicaid in here, 900 of it paid for by the federal government. That actually improves our economy because we're infusing about $1 billion into our economy. So
Correct.
we make roughly, I think it's like 47 million off of that. And again, perhaps more.
There's $47 million worth of taxes collected through economic activity created by Medicaid expansion.
So
property taxes are 11.8 million. So you take that economic activity away, and now you have $11.8 million less property taxes being collected. That's a gap. Who's going to fill it in?
Right.
We are in higher property taxes.
Just that one tax.
Just that one thing.
Let alone income tax, sales tax, things of that nature.
Or take the correctional facilities throughout Idaho. When somebody goes in there, they get enrolled in Medicaid. 90% of that gets paid for by the federal government, 10% to the state. You take that away, 100% of that now gets covered by Idaho.
Gotcha.
I mean, we could have a 2-hour-long show talking about the economic benefits of Medicaid expansion.
Understood. And again, we're here to give the information, right? Like, and I don't know what the right thing to do is. And if the people of Idaho say, hey, we don't want Medicaid expansion for somebody sitting in their mom's basement eating Doritos,
right,
then the people of Idaho can say that. That's
for sure.
On them. Yeah.
For sure. And we don't live in a perfect society. We're never going to have a pure system that fixes everything. And we talked about on the House floor just, I don't know how many days ago, there's no such thing as a perfect bill, right? So there's always going to be the guy who abuses the system, who's on Medicaid that probably shouldn't be. But of 90,000 people, let's say that's 10,000 that are doing that. Do we really want to punish the other 80 who aren't?
That's a really good point. I haven't actually heard somebody articulate that before. That's all point. Okay, what's the second thing? Because I know you're short on time.
Yeah, so
hit me with it.
Before I jump into the second thing, going back to work real quick, a representative you had on your show said that there were roughly 53% of people in Idaho on Medicaid expansion currently working and 47% not. I went to the Department of Health and Welfare's website and found that they are reporting that 80% of the people on Medicaid expansion have reportable income. Now, I don't know how you have reportable income if you're not working. So the idea that 47% of these people are just sitting in their basement eating Cheez-Its and watching Netflix, to me is ludicrous. 80% of them have income. They're working. So I struggle so much with all the numbers that get thrown around. So the next waiver, and this I think people need to really understand and this is my wheelhouse, okay? This is insurance. We have a state insurance exchange called Your Health Idaho. Okay. Let's say that you're a family of 6, you have 4 kids, and you're making, $60,000, $70,000, $80,000 a year. You can go to the exchange and you're not offered insurance at your work. You can go to the exchange and you can apply for health insurance. And the health insurance policy for your family might cost $1,500 a month. But because of your income and your family size, the federal government will give you what's called an advanced premium tax credit, or APTC. And they'll say, hey, your premium's $1,500. We're going to give you $1,400. They send the $1,400 to Blue Cross, and you send your $100 to Blue Cross, and you have insurance. Okay? That's called the insurance exchange. That is the Affordable Care Act, or Obamacare. Now, when Obamacare passed, they had Medicaid expansion part of the law. And the state said, whoa, Medicaid is a state program. You can't tell us what to do. And so it went to the courts. The Supreme Court said that's true. So then it was voluntary to do it. So they wrote into the law, if you do Medicaid expansion, we will give you 90% of the costs for that portion. All right. The rest of Medicaid, the pregnant women and children, the seniors who are in nursing homes, the disabled people, the federal government gives Idaho 68% of the costs. So on Medicaid expansion, it's 90% because of the Affordable Care Act.
Got it.
Okay. If you're a state and you do Medicaid expansion, then people who are between 100 and 138% of the federal poverty level, so household size, federal poverty level, they do not qualify for an advanced premium tax credit. It's not allowed. All right. The idea in this waiver is that we're going to take 18,000 people, not 34,000. There's roughly 18,000 of the 90,000 who fall in that gap between 100 and 138% of the federal poverty level. And we're going to give them the option to move over to the exchange and get health insurance through the exchange with advanced premium tax credit from the federal government instead of being on Medicaid. Sounds great, right?
Sounds great.
Full disclosure, I'm an insurance agent. I get paid $21 per month per head that enrolls through the exchange. So a family of 5, I'm making $100 a month when they go and get a health insurance policy. I want that, right? That sounds great. 18,000 new clients across the state of Idaho. That sounds wonderful. Okay. It's not allowed. The Affordable Care Act specifically says if you have Medicaid expansion, you cannot use advanced premium tax credits for that gap, period. So the only state that has been able to submit this waiver and make this request and had it work is Arkansas. And the way they did it is they said, okay, federal government, we can't have the tax credits to apply to these people. We'll use Medicaid dollars to be the tax credit. So that $1,400 that I would have gotten from the federal government for my $1,500 a month health plan, that $1,400 comes 90% from the federal government in Medicaid dollars and 10% from the state in Medicaid dollars. So moving people to the exchange sounds great, right? It still costs Medicaid dollars to do it.
Okay. Advanced premium tax credit. Somebody between 100 and 138% of federal poverty. You can't use the advanced premium tax credit.
Not allowed under law.
Not allowed.
President Trump can sign whatever paper he wants. It has to be Congress that allows that.
And this bill is saying we are going to use advanced premium tax credit funding to do this.
Correct.
And the Obamacare expressly prohibits that.
Correct.
And what that means is that they would have to apply for a waiver, essentially an exemption.
It's called a 1332 waiver.
They got to fill out a 1332, and it's expressly prohibited. The only person who was able to do it was Arkansas, which is like one out of.
And the reason Arkansas did it is because they said
they were still
we'll
using
use Medicaid dollars. So Arkansas is a state very similar to Idaho, very similar in its politics, very similar in its demographics. They have 3 million people. We have 2 million people. Okay, they
had Bill Clinton.
They did.
He came from Little Rock,
right?
They got yes.
Yeah,
it's a great program.
They spend twice as much per capita, so per person, on their Medicaid expansion dollars as Idaho does. Twice as much. So if our goal here is to reduce the cost to the state of Idaho, the Arkansas plan is not the way to do it.
So what you're saying is, bottom line is, what they're proposing to do, they can't do under the current law. There's only been one person who's been able to pull it off, and that person who was able to pull it off spends twice as much as Idaho.
Correct. And again, because they're increasing the enrollment. Those people are on Medicaid. They're using Medicaid dollars, but they're doing a private-public partnership with carriers to get them onto health insurance. And Arkansas's theory was, if we get healthy people on the health insurance plans, then maybe health insurance goes down for everybody. And they're still exploring whether that's working. But here's the second part to this. Idaho already has a 1332 waiver, and you can only have it's unclear, but you can only have one 1332 application. You can have multiple parts within the application, but you can only have one. The other waivers are called 1115 waivers. You can have 1,000 of those if you want. Every single situation is a new waiver, no problem. But the 1332, because of the way it was designed and built, is one application. So Idaho would have to say, we want to add to our 1332 waiver we currently have.
What is our current waiver?
You're going to love this.
Huh?
It's a reinsurance waiver. Okay. So the carriers come in and they give money to the state and they all kind of share in the cost of high risk people.
Okay.
All right. And the state of Idaho actually had to ask the legislature for $25 million to make that work. Because in order for it to be deficit neutral to the federal government, we had to put money in. $25 million. Now, last year, 2024, it kept our insurance rates 20% lower, which is roughly $100 million of savings.
That sounds like a great return.
Correct.
Great.
And our Department of Insurance under Director Cameron is phenomenal.
Go Director Cameron.
Okay.
Way to be.
But this waiver has to be renewed every 5 years. We got it in 2022. All right. So it's not up for renewal till 2027. If we go to the federal government and we say, hey, we want to add to this waiver, and we'd like you to do, allow us to do what's called the choice plan, which is moving people to the exchange. The federal government could say, no, can't do that. And
then would we lose the... Because they can't accept, because you only have one application. You have to wholly accept the whole thing or wholly reject the entire application. So we would lose our current exemption.
Here's the thing, Matt. We don't even really know, because there isn't a single state in the whole country that's been able to do it. All right. There isn't one. All of the states in our country who have 1332 waivers have one part to their waivers. And almost all of them are the reinsurance, just like Idaho has, except Arkansas, who I've just described. So we don't know. Do we want to take that risk that everybody's insurance rates goes up 20%? Now, there's 2 million people in Idaho. Roughly 50% are on private insurance. And if the average insurance policy is $500, that's $500 million. 20% of that's $100 million. So we're over here complaining about the state spending $100 million, but there's this risk that we lose that waiver. And now everybody pays an additional $100 million for our insurance. Why? Why do we have this trigger in here that says do this or else? And all of the or else's are not possible. Why don't we just say, hey, let's try and get these waivers. Let's see what happens. And maybe we get some of these waivers, and maybe we reduce costs, and maybe we save the taxpayers money. Why in the world do we think that telling the federal government what to do is somehow going to work because Trump's the president? I love Donald Trump. I love what he's doing. I'm excited for the changes, but come on, this does not make sense.
Representative Fuhriman, I know you're on a time crunch.
Yeah, I'm sorry. I wish I had more.
Listen, you'll have to come back. That's how it is. I really appreciate you explaining this. I am not an insurance guy. And when people are talking about the problems, like the train wreck that is our insurance system is really one that I've never been able to wrap my head around. And it's like, I've tried to chat with people, but again, having this type of information really helps me kind of get like, okay, this is why this is going to be a problem for this category of people or whatever it might be. So
if I can, I just remembered something, and it has to do with what we were just talking about.
Full send.
I forgot to tell you that in 2019, after Medicaid expansion was passed, the Department of Insurance actually went after a 1332 waiver to move people to the exchange, like we just talked about. Mm-hmm. And it was denied. The CMS said any Section 1332 waiver application that would increase the federal deficit cannot be approved by the federal government. And Idaho was unable to prove that it would not increase. This is going to sound crazy. All right. Our federal government is stupid sometimes. But when you look at the advanced premium tax credits, it's 100% paid for by the federal government.
Okay.
All right. It doesn't matter if it's $1,000, $500, it's 100%. When you look at the Medicaid expansion, it's 90% paid for by the federal government. So when they look at that and they say, why would we go from paying 90% to paying 100%? That's not neutral. Now, I know the dollars might be neutral or less, but the federal government looks at the cost sharing. They don't care if Medicaid costs $1 gazillion. They're going to pay the 90%, right? But if they have to pay 100%, they're paying more.
Even if it's gazillion minus $1.
Right. Which is why our federal government is absolutely ridiculous. But that's how they look at these things. And that's why in 2019, it was denied. So then our Department of Insurance said, well, if we can't get that one, then let's get the reinsurance one, right? And that's where we're at. So guess who was president in 2019, Matt?
Well, I'm pretty sure it was President Trump. I don't really have to guess.
Right? Why do we
It's more of like, do you remember?
why do we think it'll be different today?
Yeah.
So I just struggle. The fiscal note from this, it will cost the Department of Health and Welfare $3.8 million to apply for the waivers, just to try to get them. And then it will cost $3.4 million every single year to maintain them. And it will take 17 full-time employees because they have to consistently provide information and data and fill out reports on an annual basis. It's just, I know that 3.4 million is small compared to 100 million, but it's still $3.4 million and 3.8 just to try. So I appreciate this time very much. I hope that people will realize that there are efforts being made in the state house to save money with Medicaid. Montana has a work requirement plan that works. It doesn't require the federal government's help, and it is getting people off of Medicaid. It costs them $3 million a year to manage. That's a lot better than Georgia's $26 million a year. We could try that. Let's try it, right? We have community housing where people who have different various degrees of disabilities who are in institutions costing $85,000 to $120,000 a year, and we can move them to community housing where it costs $6,000 a year. Let's expand that. Let's get people out of these programs where Medicaid's. There are things we can do and try that don't destroy the whole thing. So I just hope anyone who's listening, who took the time to hear this, and especially fellow legislators, that they'll realize that this is a repeal bill. Regardless of the intent, this bill will repeal it. And I only covered 2 of the 11 waivers. And we need to try something different.
Representative, I appreciate you. Please come back.
Thank you.
We'll do it again.
All right.